I'm about to reveal something that might shock you. Your doctor just told you your vitamin D level is normal, and you felt relieved. You thought everything was fine. But that number they called normal may be quietly taking away your ability to stand up from a chair. It may be weakening your bones to the point where a simple stumble could change your life forever. By the end of this video, you'll understand why trusting that single word, normal, can cost you your independence. I'm Dr. Maria Lee. After more than 20 years treating older adults, I've watched the same story repeat itself again and again. A patient gets their vitamin D checked. The result comes back. The doctor says it's normal. And a few months later, everything falls apart. A hip fracture, severe muscle weakness, loss of independence. And no one ever connects it back to that lab result everyone dismissed as fine. Your vitamin D level could be sitting in the normal range right now while your body is quietly breaking down. And there is one very common mistake, something millions of seniors do every single day, that can make vitamin D almost useless even if you're taking it. I'll explain that mistake shortly. But first, you need to see what happens when people trust the word normal. Let me tell you about Margaret. Margaret was 73 years old. She was a former nurse, strong, capable, and fiercely independent. She lived alone in her own home and managed everything herself. She liked her life exactly the way it was. During her annual checkup, her doctor ordered routine blood work. Her vitamin D level came back at 31. Her doctor called her and said everything looked good. He told her her vitamin D was 31, that the normal range was 30 to 100, and that she had nothing to worry about. Margaret felt relieved. Normal meant normal. She trusted that result. She trusted her doctor. She had worked in healthcare for decades herself. She knew how lab values worked. Or at least she thought she did. 6 months later, Margaret walked out to her mailbox on a warm, sunny morning. It was the same short walk she had taken thousands of times before. Nothing unusual happened. Her foot caught slightly on a small, uneven patch of concrete. It was a tiny stumble, the kind that usually means nothing. But this time, her body didn't respond. Her leg muscles didn't fire the way they should have. She couldn't catch herself. She went down. The fall wasn't dramatic. It wasn't from a height. It was the kind of fall most people walk away from. But when Margaret hit the ground, her hip shattered. The femur, the strongest bone in the human body, broke completely. She was in unbearable pain and couldn't move. A neighbor heard her cries and called for help. She was taken to the emergency room, where X-rays showed the full extent of the damage. She needed surgery. Metal plates, screws, and pins were used to hold her hip together. She spent days in the hospital and then months in rehabilitation, learning how to walk again. She worked hard in physical therapy and followed every instruction. But something fundamental had changed. She never felt safe again. She was afraid of falling. She couldn't manage the stairs in her home. She couldn't live alone anymore. Eventually, she moved in with her daughter. What was supposed to be temporary became permanent. She lost her home, her routines, and the life she had built over 35 years. She now uses a walker and depends on others for things she once did without thinking. What makes this story so devastating is that it was preventable. Every part of it. 6 months before that fall, Margaret's vitamin D level was tested. It was 31. Her doctor looked at the reference range, saw that it was above 30, and labeled it normal. But that level was not adequate for her body. It was not enough to maintain muscle strength. It was not enough to protect her bones. It was barely enough to prevent a childhood bone disease. That reference range exists to prevent severe deficiency, not to preserve strength, balance, and independence in older adults. No one explained this to Margaret. No one told her that normal does not mean optimal. It simply means you don't have an obvious deficiency disease. For months, her muscles weakened. Her bones lost density. Her body slowly failed her while she believed everything was fine. Vitamin D is critical for muscle contraction. When levels are too low, muscles don't respond properly to nerve signals. They don't react fast enough to stop a fall. At the same time, vitamin D is essential for calcium absorption. Without enough of it, calcium cannot be deposited into bone. Your body then pulls calcium out of your bones to keep vital systems running, leaving your skeleton fragile and brittle. That is exactly what was happening to Margaret while her lab result was being called normal. And I haven't even told you yet what her vitamin D level should have been. Before I do, I need to tell you about Robert, because his question is probably the same one you're asking right now. His legs felt heavy and tired, as if he were walking through thick mud. He began stumbling on flat ground, tripping over nothing at all. His balance felt off in a way he couldn't explain. He went to his doctor and described exactly what was happening. The doctor performed a full neurological exam, checked his reflexes, his coordination, and his sensation. Everything looked normal. There were no signs of nerve damage, no stroke, no Parkinson's disease. The doctor ordered a vitamin D test. The result came back at 33. The doctor told him that was normal, explaining that the reference range was 30 to 100. Then he added, almost as an afterthought, that it wouldn't hurt to be proactive. He suggested Robert start taking a multivitamin every day since it contained vitamin D. Robert did exactly what he was told. Every morning with breakfast, he took his multivitamin. He never missed a day. He believed he was doing the responsible thing and following medical advice. 6 months passed, but instead of improving, his weakness worsened. The stumbling became more frequent. His legs felt unreliable, as if they might give out at any moment. One evening, Robert stood up from the dinner table. It was a simple movement he had done thousands of times. This time, his legs buckled completely. They didn't hurt. They didn't warn him. They simply stopped working. He fell hard onto the floor, bruised his ribs badly, and lay there confused and frightened, unable to understand why his body had failed him. A week later, Robert came to see me. I reviewed his records and saw the note, vitamin D level 33, normal, advised multivitamin supplementation. I asked him if he was taking it. He said yes, every single day for 6 months. I asked him to show me the bottle. When I looked at the label, I immediately saw the problem. The multivitamin contained 400 international units of vitamin D. That was the first major mistake. 400 units is essentially useless for correcting low vitamin D in someone over 60. It will not meaningfully raise levels. It is barely enough to prevent severe deficiency. For most older adults, raising vitamin D into a truly healthy range requires 2,000 to 5,000 units per day. Robert had been taking less than 1/5 of what his body needed. We repeated his vitamin D test. After 6 months of daily supplementation with 400 units, his level had increased from 33 to 35. 2 points. Practically nothing. He had believed he was fixing the problem, but in reality, nothing had changed. This is happening to millions of seniors right now. They take a multivitamin, see vitamin D listed on the label, and assume they're covered. In truth, they're taking a dose that does almost nothing. But there is a second mistake, and this one makes vitamin D ineffective even when the dose is high enough. Let me tell you about Helen. Helen was 78 years old, a retired librarian who had loved books her entire life. Over the past year, she had been constantly ill. One respiratory infection after another. A cold would turn into bronchitis, antibiotics would clear it, and then another infection would appear a few weeks later. She was exhausted and felt worn down all the time. Her doctor ran extensive tests. Everything looked normal, including her immune markers. Her vitamin D level was 29, which the doctor described as borderline low. This time, he prescribed a real supplement, 2,000 units of vitamin D3 per day. Helen bought the supplement and began taking it every morning as soon as she woke up, on an empty stomach with a glass of water. She did this faithfully for 3 months. When her vitamin D was rechecked, it had risen from 29 to 32. Barely a change. Her doctor increased the dose to 4,000 units daily. Helen continued taking it the same way. 3 months later, her level was 36. Better, but still not where it should have been. She was still getting sick and still felt drained. When Helen came to see me, I asked her a simple question. When do you take your vitamin D? She told me she took it first thing in the morning, before breakfast, on an empty stomach, because she thought it would absorb better. That was the second mistake. Vitamin D is fat-soluble. It cannot be absorbed properly without fat. When you take it on an empty stomach, your body absorbs only a fraction of the dose, often 20 to 30%. The rest passes straight through your system. Helen was taking 4,000 units, but absorbing closer to 1,200. Not enough to restore immune function or rebuild muscle and bone. I told her to take her vitamin D with food, specifically a meal that contained fat. Eggs, yogurt, olive oil, avocado, anything with natural fat. She changed nothing else. She simply took the same dose with breakfast instead of before breakfast. 8 weeks later, we checked her vitamin D again. Her level was 52. Her infections stopped. Her energy returned. For the first time in a year, she felt like herself again. This is the truth most people are never told. A vitamin D level in the low 30s is not optimal for older adults. For muscle strength, balance, bone density, and immune function, most seniors do best with levels between 45 and 60. And reaching that range requires two things: an adequate dose and proper absorption. If you are taking vitamin D but only getting it from a multivitamin, it is almost certainly not enough. If you are taking a higher dose but swallowing it on an empty stomach, much of it is being wasted. And if your doctor told you your level was normal without explaining what that really means for your age, your muscles, and your bones, you are not getting the full picture. Vitamin D is not about avoiding a deficiency disease. It is about preserving strength, balance, and independence. The difference between a level of 31 and a level of 50 can be the difference between catching yourself when you stumble and shattering a hip that changes your life forever. 3 months later, we checked her level again. It was 61, and something remarkable happened. The infection stopped. Completely. She went 8 months without getting sick even once. Her immune system, finally getting the vitamin D it needed, could actually do its job. All because of one simple change: taking vitamin D with food instead of on an empty stomach. Most people don't know this. Most doctors don't explain it. They tell patients to take vitamin D and assume that's enough. But patients aren't told how much to take or how to take it, and the supplement quietly fails. Then everyone assumes vitamin D doesn't really work. Now you understand the two major mistakes. First, not taking enough. The 400 or 800 units in a multivitamin are essentially useless for seniors. To actually raise vitamin D to a healthy level, most people over 60 need between 2,000 and 5,000 units daily, depending on where they're starting. Second, taking it on an empty stomach. Vitamin D must be taken with food that contains fat. Without fat, absorption is poor and most of the dose is wasted. These two mistakes alone explain why so many older adults are taking vitamin D but still have low levels, weak muscles, fragile bones, and frequent infections. But there is another critical piece you need to understand: the number itself. The 31, the 33, the 29. Why are these numbers considered normal by the lab, yet so dangerous for seniors? Let me tell you about Dorothy. Dorothy was 75 years old, and gardening was her life. It wasn't a hobby. It was who she was. Her yard was full of roses, tomatoes, peppers, and flowers she had carefully tended for years. She spent hours every week digging, planting, and weeding. It brought her joy and purpose. Then, over about 6 months, everything changed. Gardening became harder. Her arms felt weak. The watering can suddenly felt too heavy. Her legs tired quickly. She would kneel to pull weeds and struggle to get back up, rocking forward and pushing with her hands. It was frustrating and embarrassing. Slowly, she spent less time in the garden. Smaller sections, shorter visits. Eventually, she stopped altogether. It wasn't just gardening. Getting out of chairs became difficult. Opening jars took effort. Carrying groceries felt exhausting. She felt weak and frail in a way she never had before. Old, even though she was only 75. Her daughter brought her to see me. She was worried. "She's wasting away," she said. "She's getting weaker and nobody knows why." I checked Dorothy's vitamin D. It was 28, right at the bottom of what many labs still call acceptable. I asked if it had been checked before. Dorothy pulled out old lab results. 2 years ago, 32. 1 year ago, 30. This year, 28. Her vitamin D had been slowly declining year after year. And as it dropped, she was losing muscle. This is called sarcopenia, age-related muscle wasting. When vitamin D falls below a critical level, muscle protein synthesis decreases. Muscle fibers break down faster than they are rebuilt. Actual muscle tissue is lost. Muscles shrink. That is exactly what was happening to Dorothy. Imaging studies show this clearly. Seniors with vitamin D levels below 30 have significantly less muscle mass than those with levels above 50. We're not talking about minor changes. We're talking about losing 20 to 30% of muscle mass over a few years. And once that muscle is gone, getting it back is extremely difficult, especially in your 70s. We started Dorothy on 5,000 units of vitamin D3 daily, taken with food. No skipped doses. We also added very gentle resistance exercises, light bands, small weights, slow and careful movements. Progress was slow, painfully slow. But over time, she did regain some strength. Her arms filled out slightly. Her legs became more stable. She can garden again now, not for hours, not the way she used to, but seated in shorter sessions. She's doing what she loves again, and that matters. Here's the hard truth. If someone had acted 2 years earlier, when her level was 32, and said, "That's not enough for your age," she would never have lost that muscle. Her independence would never have been threatened. Now let me tell you about Thomas, because his story explains why calcium supplements don't work without adequate vitamin D. Thomas was 71, active, played tennis, walked regularly, ate well. His doctor ordered a routine bone density scan. It showed osteopenia, early bone thinning. Start calcium supplements, his doctor said. 1,200 milligrams a day. Thomas followed instructions perfectly. He bought good quality calcium and took it every day. 2 years later, he repeated the bone density scan, confident things would be better. They weren't. His bones were significantly worse. He had progressed from osteopenia to full osteoporosis. Here's why. Calcium cannot get into your bones without vitamin D. You can swallow calcium all day long, but if vitamin D is inadequate, your body cannot absorb and use it properly. Worse, your body will pull calcium out of your bones to keep blood calcium levels stable, weakening them further. Thomas's vitamin D was 30. Technically normal. Functionally inadequate. The calcium never had a chance. Once we corrected his vitamin D and then addressed calcium intake properly, the bone loss finally stabilized. This is what you need to take away. For seniors, normal vitamin D is not enough. Levels in the low 30s are associated with muscle weakness, falls, fractures, immune dysfunction, and bone loss. Most older adults function best with levels between 45 and 60. To get there, you need an effective dose and proper absorption. That means a real supplement, not a multivitamin, and taking it with food that contains fat. Vitamin D is not just a lab number. It is the difference between strength and frailty, independence and dependence, living in your own home and losing it. Do not let the word normal fool you. Despite taking calcium supplements every single day for 2 full years, Thomas continued to lose bone density at an alarming rate. His doctor was genuinely puzzled. "I don't understand this," the doctor said. "You've been taking calcium faithfully. You're physically active. Your diet is good. Why are your bones still getting worse?" More tests were ordered. Thyroid function came back normal. Parathyroid hormone, however, was elevated. That stood out. It was an important clue. Then the vitamin D result came back, 35. "Your vitamin D is normal," the doctor said. "It's in the reference range." That's not the problem. But that level of 35 was exactly the problem. What no one had explained to Thomas, and what many doctors still don't fully understand, is that calcium does not automatically go into your bones just because you swallow it. First, your intestines have to absorb it from your digestive tract. Then it has to be transported through your bloodstream. Finally, it has to be deposited into bone tissue. Every single one of these steps depends on adequate vitamin D. When vitamin D is insufficient, your intestines can absorb only about 10 to 15% of the calcium you consume. Thomas was taking 1,200 milligrams of calcium every day, but he was absorbing only about 150 to 200 milligrams of it. The rest, more than 1,000 milligrams, was passing straight through his body, completely wasted. And it gets worse. Your body needs calcium immediately for critical functions, maintaining heart rhythm, enabling muscle contraction, transmitting nerve signals, and allowing blood to clot. These processes cannot wait. If blood calcium levels drop too low, the heart stops beating. Death follows. So when your body cannot absorb enough calcium from food or supplements because vitamin D levels are too low, it activates an emergency backup system. Calcium is pulled directly out of your bones. Your parathyroid glands, 4 tiny glands in your neck, monitor blood calcium levels constantly. When they sense a drop, they release parathyroid hormone. This hormone tells your bones to release calcium into the bloodstream. It keeps you alive. It keeps your heart beating. But it does so by slowly destroying your skeleton. Thomas's elevated parathyroid hormone level proved this was happening. His bones were being actively mined. Calcium was being stripped from them every day just to keep his blood calcium stable because he could not absorb enough from the 1,200 milligrams he was taking. This process is called secondary hyperparathyroidism, and it is extremely common in people whose vitamin D levels sit in the so-called normal range of 30 to 40. For 2 years, Thomas's body had been cannibalizing his own bones while everyone believed the calcium supplements were helping. They weren't. They couldn't help without adequate vitamin D to make calcium absorption possible. We started Thomas on 5,000 units of vitamin D3 daily, taken with food. His vitamin D level rose to 58. His parathyroid hormone normalized. His intestines could finally absorb the calcium he was taking. His bone loss stopped. When we repeated his bone density scan a year later, it had stabilized. The decline had halted. We had caught the problem before he suffered a hip fracture like Margaret. But only because we finally addressed the real issue, a vitamin D deficiency that everyone had labeled normal. Now I need to tell you about Richard, because his story links vitamin D to something that may be even more frightening than weak bones or muscle loss, something that determines whether you remain yourself or slowly lose who you are. Richard was 79 years old, a retired college professor. He had spent 40 years teaching literature. His mind was sharp, his memory exceptional. He could quote Shakespeare and Milton effortlessly. He loved books, ideas, and long conversations. Then things began to change. He started misplacing his keys and glasses. He would walk into a room and forget why he was there. His wife noticed he was repeating himself, telling the same story he had shared an hour earlier, asking the same question multiple times in one afternoon. She brought it up gently. Richard dismissed it. Everyone forgets things sometimes, he said. But the changes continued. They became more frequent, more obvious. His doctor performed cognitive testing, memory assessments, clock-drawing tasks, standardized screening tools. The results showed mild cognitive impairment, not normal aging, real decline. An MRI followed. It showed brain atrophy and white matter changes. The neurologist reviewed everything and said, "This is likely the early stages of Alzheimer's disease. We're going to start medication, Aricept, Memantine, and monitor you closely." Richard and his wife left that appointment devastated. They knew what Alzheimer's meant. They had seen friends slowly disappear, confusion, fear, the eventual loss of identity, the inability to recognize family. They drove home in silence, both terrified of what lay ahead. When Richard came to see me, I reviewed his records carefully. Every test, every lab, and I found something that had been overlooked. A vitamin D level from 6 months earlier, 32, squarely in the lab's normal range. No one had mentioned it. No one had thought it mattered. But here is what many doctors still do not understand. Your brain is covered in vitamin D receptors. They are found throughout brain tissue, in the hippocampus, where memories are formed, in the cortex, where thinking and reasoning occur, everywhere. Vitamin D is essential for brain health. It protects neurons from damage. It helps clear toxic proteins. It reduces inflammation. It maintains communication between brain cells. When vitamin D is low, the brain ages faster, much faster. Beta amyloid, the toxic protein associated with Alzheimer's disease, accumulates more rapidly. The brain's natural cleaning system does not function properly. Inflammation increases. Neurons die at an accelerated rate. Brain volume shrinks. A major study published in the journal Neurology followed 1,658 seniors for 5 years. Vitamin D levels were measured at the start, and participants were tracked over time. Those with vitamin D levels below 30 had a 53% higher risk of developing dementia compared to those with levels above 50. Not a small increase. More than half again as likely. Those with levels below 20 had more than double the risk. Brain imaging studies show the same pattern. Seniors with low vitamin D lose brain volume faster. Their brains physically shrink at an accelerated rate. And this is not just correlation. Researchers are now identifying the mechanisms. Low vitamin D allows toxic proteins to build up faster and weakens the brain's ability to remove them. We started Richard on 5,000 units of vitamin D3 every day, taken with food. Richard began taking his vitamin D every morning with breakfast. He did not miss a single dose. 3 months later, we rechecked his level. It had risen to 62. And then something happened that the neurologist had said was impossible. Richard's cognitive function improved. Not completely. He did not return to how he was 10 years earlier. Some of the damage was likely permanent. But the decline stopped. The memory problems stabilized. He was clearer, more present, more engaged, more himself. His wife told me something I will never forget. "I got my husband back," she said. "I thought I was losing him. I thought he was disappearing right in front of me. But he's here. He's back." Was it the vitamin D? Was it the Alzheimer's medications? Was it both? No one can say for certain. But the timing was impossible to ignore. And even if vitamin D only helped partially, even if it only slowed the decline rather than reversing it, that still matters enormously. Because with dementia, any stability is a victory. Not getting worse is success. Richard gained years of being himself, years with his family, years of conversation, reading, and thinking clearly, years of living as the person he had always been, all because a vitamin D level that had been labeled normal was finally corrected. Now you have heard 6 stories. Margaret with her shattered hip and lost independence. Robert with failing muscles and frightening falls. Helen with constant infections and exhaustion. Dorothy with wasting muscles and a lost passion. Thomas with dissolving bones despite taking calcium. Richard with fading memory and a terrified family. All 6 of these people had vitamin D levels between 28 and 35. All 6 were told those levels were normal. All 6 suffered devastating, life-changing consequences. And every one of those consequences was preventable. Completely preventable. If someone had simply told them the truth. Here is the truth. That reference range of 30 to 100 printed on lab reports is designed to prevent rickets and osteomalacia. Diseases from the 1800s where children's bones became so soft they bent. To prevent bones from literally bending, you need a vitamin D level above 30. That is what normal means. Nothing more. But you are not a child. You are not trying to prevent rickets. You are trying to maintain muscle strength so you do not fall and shatter a hip like Margaret. You are trying to preserve bone density so a fall does not break you. You are trying to support immune function so you do not die from pneumonia. You are trying to protect your brain so you do not lose yourself like Richard almost did. And for all of that, research consistently shows you need a vitamin D level between 50 and 80. Not 30. Not 35. Between 50 and 80. Margaret's 31. Robert's 33. Helen's 29. Dorothy's 28. Thomas's 35. Richard's 32. Every one of those normal levels was less than half of what their bodies actually needed to function properly. And everyone told them they were fine. Here is exactly what you need to do. Step by step. Step 1. Get your vitamin D tested. Ask specifically for the 25-hydroxy vitamin D test. Do not assume anything. Measure it. Step 2. When you get the result, get the actual number. Do not accept it's normal. Write the number down. If it is below 50, you need to act, regardless of the reference range. Step 3. Buy vitamin D3, not D2. The label must say D3 or cholecalciferol. D2 is synthetic and far less effective. Step 4. Choose the dose based on your level. Below 30, 5,000 IU daily. 30 to 40, 4,000 IU daily. 40 to 50, 2,000 to 3,000 IU daily. Step 5. Take it every single day with food that contains fat. Eggs, avocado, fish, olive oil, nuts, butter. Without fat, absorption is poor and the supplement is wasted. Step 6. Recheck your level after 3 months. You must confirm the dose is working. Step 7. Adjust as needed. Your target is 50 to 80. If you are still below 50, increase the dose. If you are above 80, reduce it slightly. Step 8. Once you reach that range, maintain it for life. If you stop, levels will fall again within months. Step 9. Pay attention to how you feel. Strength, balance, infections, mental clarity. These are signs it is working. Give it time. 3 to 6 months. And no, 5,000 IU daily is not dangerous. Vitamin D toxicity does not occur until blood levels exceed 150, which requires extremely high doses for a long time. The doses described here are safe and well-studied. The fear of vitamin D toxicity is largely propaganda. It is misinformation that keeps people taking tiny, ineffective doses while remaining deficient. The real danger is not taking too much vitamin D. The real danger is not taking enough. Your vitamin D level right now, at this very moment, could determine whether you stay in your own home or eventually need someone to care for you. It can be the difference between staying mentally sharp and recognizing your grandchildren or slowly losing that ability. It can mean remaining strong and active or becoming frail and dependent. It can determine whether you continue living the life you want or lose the things that matter most to you. Do not let anyone tell you that a level of 32 is fine just because a lab report labels it as normal. Do not let anyone tell you that a multivitamin is enough. Do not let anyone dismiss how you feel simply because your tests are marked normal. Your body is giving you signals. You need to listen to them. Get your vitamin D tested. Get the actual number. Choose vitamin D3 in therapeutic doses. Take it every single day with food that contains fat. Recheck your level in 3 months to confirm it is working. Adjust the dose if necessary. And once you reach an optimal level, do not stop. This is one of the most important actions you can take for your health. In many cases, it is more important than most medications and more impactful than many medical interventions. If this video helped explain why you feel weak even though everyone says your lab results are fine, share it. Send it to everyone you know over the age of 60. Subscribe to this channel because my mission is to share clear, honest health information that can help you stay independent and strong, information that many doctors either do not know or do not have time to explain. Thank you for watching. Take care of yourself. And I will see you in the next video, where we continue cutting through medical misinformation that may be keeping you from living your best life.